Namaste and welcome back to my channel. Today we are going to see the surface landmarks for marking of the Gracilis flap. Thankfully I have a volunteer after all this time, hence I'm recording it now. So the position for the marking of the Gracilis flap is with the patient in supine. The knee is slightly flexed and the hip is laterally abducted. So this sort of position of the leg is very important for you to be able to identify the gracilis, which is in the medial most compartment of the thigh. Now our anatomical landmarks are going to consist of the medial femoral condyle, which we can palpate easily, and it is going to be the inferior border of the pubic ramus and the ischium. So these two are going to be the landmarks. It is always helpful to have a handheld Doppler so that you can also identify the vascular pedicle. So to able to identify this axis, you can make use of a measuring tape or a straight line ruler, and basically we are going to connect these 2 points, which is the lower part of the ischium. I'm not talking about the ischial tuberosity but the ischium, and we are going to connect it to the medial femoral condyle. It also helps to know the landmark of around 8 to 10 centimeters, because this is where the vascular pedicle is going to enter into the gracilis muscle. So now we all know that the blood supply of this flap is from the medial circumflex femoral artery, that is from the MCFA. Now the medial circumflex femoral artery, which comes from the profunda femoris, from the main femoral artery, is going to enter into the gracilis flap. Now remember, this axis is not directly of the gracilis muscle. Gracilis muscle is going to be medial most. The muscle that you can palpate in this region is the adductor longus, and this is going to be the septum where the pedicle will enter. So once you make your incision, you have to have an idea where your skin paddle should lie, and it is best identified at the proximal most part, because that is where your pedicle will enter into the flap. So for this you need to make an incision which is in the septal area. Always remember, you are going to be sitting along the region of the thigh, and the first muscle that you see is going to be long, tubular and flat. That is going to be your adductor longus. Then you will identify the septum between it, and medially you will find your muscular belly, which is going to be the gracilis muscle, and it is more of a tubular muscular belly with a long tendinous insertion. So in order to identify the pedicle, you can run a handheld Doppler along this region, and you will be able to identify the pulsations at around 8 to 10 centimeters. Now it is important to note the entry of this pedicle, because as we had seen in the first video, the gracilis is a type 2 muscle flap. That means it is going to have one dominant pedicle and few other minor pedicles that are going to come distal to the main one. So once we start to elevate this muscle flap and we have identified that the dominant pedicle is good, we will ligate all the vessels distally, and the flap will be harvested based on the main pedicle. Also remember that this is an innervated free functional muscle transfer, and therefore the obturator nerve anterior branch will also run along with the pedicle and enter into the muscle. It has to be saved with a good length to be able to use this muscle as a free functional muscle graft. Free functional muscle flap. In most of the cases, especially when we use it for upper limb such as brachial plexus or Volkmann's ischemic contracture, we need this long tendinous belly, for which a small incision is made at the level of the medial condyle, and the entire tendinous portion is harvested. If you are looking to use the gracilis as a muscle for the facial palsy, then in most of the cases we will just need a small bulk of the gracilis muscle, and you will also not require the skin paddle. The skin paddle, as discussed, is precarious in a lot of cases in the gracilis muscle flap. Therefore, it should be harvested with utmost care and should be positioned over the proximal part of the vascular pedicle. This skin paddle helps to serve as a monitoring device when your muscle is buried deep under the tissues, So from outside you can see whether this skin paddle is surviving, you can run a Doppler over it, and you can help and monitor your muscle flap. So these are the main points of harvest of Gracilis. Always remember, the first one that you see is going to be your adductor longus. You will have to retract the adductor longus to then see the Gracilis muscle, and that is the flap that we are going to harvest.